want to hear from you. What are some ways to make it so that the priorities of people that we live with, who live with inequities, actually inform public health decisions? So we'd like you to offer us some thoughts here. And then we thought we would see what ideas you have. I'm going to leave that for a second. What do you think? What are some ways that we can actually meaningfully feed the priorities of the community forward to inform? So we've got a few things coming in. And Heather and Nancy, I'll ask you to both unmute so we can share our thoughts and perspectives. What do you think about what's coming up here? I like this one. Someone has said acknowledging intersectionality.
And I think what I see a lot of this really is that relationship piece. You know, we talk about that. That's so important. The relationship, the trust has to come before the advocacy and the policy pieces. So taking that time to authentically build those relationships, I think, is key.
Yeah. And I think, too, for me, and it seems like such a small issue, but it's actually reaching out and inviting people to participate, because a lot of us who work within systems are so used to getting a meeting invite by email. But for a lot of individuals, especially for our folks who live with inequities in the system, we really need to reach out and invite them and help them feel welcome to the table. And there was a woman, Diane, I don't remember her name, so I'm not stealing her idea. I'd give credit if I could think of her. You might remember her from when we spoke in St. John, but she actually went through the process of handwriting invitations for the elders in her community to participate, which I thought, it's a small thing, but it means so much. And then there's that personal connection to get people to the table and participate.
Yeah, I remember that, and it was such a simple and basic kind of idea, but it was kind of earth-shattering for everybody in the room, because we all thought, oh, we could just handwrite, and because it's the personal touch, right? There's some interesting ideas coming in here too. You know, having a variety, engaging people who are there in spaces and places that make sense to them, having a variety of approaches for different groups, and so, you know, it's recognizing that different groups have different places and spaces that make sense to them. And Dave in the chat box had said earlier about First Nations communities that he works with, that every community may actually have a different set of values and a different way of being and a different way of knowing, and it's important to respect the uniqueness of all of that as well. So there's some really interesting pieces here. I think we're going to move to the next polling question. I want people to know that we can feed back the collective responses to people if they're interested in a few weeks after the webinar, and that way maybe we can all learn a bit from everyone's ideas. And if you've got other thoughts, please offer them in the chat. So maybe we'll ask you another question here. So thinking about, you know, what we just talked about what are some ways to do it, where do you think we get stuck? Where do you think we get stuck when we're trying to do this? So now we've got strategies and now we've got ideas. What might be a barrier? So someone's written the data, or maybe the lack of data, because sometimes I hear about the lack of data. Red tape, pushback from management that speaks to leadership, right? Politics, this is interesting.
I think for me
too. Heather and Nancy,
yeah, that's a good one. And one thing too I find, especially when we talk about health, it's the language that we use. And I find even myself, because I'm a non-clinical person, so when I'm talking to a team where I'm probably the only non-clinical, I feel out of place at times, and I'm thinking, well, how about Joe down the street who doesn't engage with these people at all? so kind of the way we speak in these groups and the language that we use is not welcoming, and I understand it's how business is typically done in health, but we need to remember that when sometimes people get stuck because if they show up to a meeting and it sounds like you're speaking another language, I'm probably not going to come back, and sometimes it's just good for us to remember that.
Yeah, for sure, for sure. Nancy, did you have any comment here?
Well, I'm just looking at institutional racism that's popped up here, and I do think, particularly in our health world, that we do have to acknowledge that, and we have to pay attention to that, and really try to dig into that a little bit, because people are coming into, even if we're inviting them intentionally and authentically, they're coming to our tables with a lot of experiences that sometimes we need to take that pause and unpack a bit. So I think that's an interesting concept. I think that there's definitely something there.
Yeah, and racism is one of those structural determinants that we're starting to look more closely at, that really spans across sectors, and the different types of racism: anti-Indigenous, anti-Black racism, and anti-Muslim racism, and anything based on religion and skin color. It's a really powerful force that can really limit. I know someone here in our poll mentioned organizational, what is the word here? Like organizational pushback or organizational types of limitations. And so we're doing some work around organizational capacity. Any thoughts around where we might get stuck organizationally at an organizational level?
I think for me, it's because we're asking a system that has been designed to treat a specific illness to work differently and focus on the experts being the community as opposed to the experts being, the doctor or the nurse to diagnose something. It's that one of the areas I work in, we run into a challenge because doctors, for example, are trained in the biomedical model where it's assess, diagnose, and treat. And you can't do that with community. It doesn't work that way. So sometimes it's just challenging for them to learn a different way. And it's not that they don't want to. It's just that doesn't always align with their training. So I think we get stuck sometimes when we run into kind of these preconceived structures or these ways that we interact, especially around health. It's shifting the power model a bit, or the power differential a bit, which again, it's a change, and not everybody likes change, and it takes time.
I agree. I think there's something to that power differential, and that widening gap that we see in community. So it is much harder to have those really important lived experience voices at the table often, and are often not fully represented in our systems. So in community, I think that's why our role is so important, to really suss that out, as opposed to the folks who sometimes at the power tables are speaking from a much more limited set of voices.
Yeah, you're right. And Ashika, I think we can close that poll actually and pull the next one up, because there was one comment there about, we have one of the places we get stuck is that we have a preset idea of how to do things, and are we really ready to do things differently? And that relates really well to this question. So, what will we give up? What do we need to give up or suspend to work together differently? So that might be, we've got ego and control, power. Those are things internal to us as human beings. There might be external things as well, so timelines, demands. I often hear demands from our mandate for public health. So I'm interested to hear from our audience in this one. What would we need to give up? Control, power, the preconceived notions of who an expert really is. So this is a really interesting one. And please keep adding your answers, and I have a comment about this one. I was at a session last fall, and we talked about that term, lived experience, that we often hear. And there was a big discussion about how it's, lived experience, it's really important to recognize that people have lived experience. When you call it expertise, it adds a legitimacy to it for some people. It's already legitimate, but the power of words is strong. Maybe calling it lived expertise or grounded expertise can change who we consider the experts in what is needed at a community level. So,
and Diane, if I could just tag on to that, one of the links I posted in the chat box is a document from Tamarack, and what I really love is they talk about content experts and context experts and recognizing the value of both. And I think I've started incorporating that when I talk about having community members. I refer to them as context experts because they know the context. Content experts don't. So it kind of puts everyone on an equal playing field, and it's the language that reinforces everyone has expertise to bring. But it is a shift for a lot of people. So, but that there is a document there in one of the links I shared. It's an interesting read.
Yeah, yeah.
Diane, I would add, I participated in the How We Thrive conference in Nova Scotia a few months ago, and there was a system change workshop, and one of the concepts there was stretch collaboration, which I love that because it sort of is, how do we collaborate with our unusual suspects, not our usual partners, in a way that stretches us all so that we can all give up a little bit to have a collective gain in the end. So I think there's something to that, and again, some of the power differentials come into that.
Yeah. And I think, and we can probably close this poll before we pull out the other one, though. I was just looking at a comment there about giving up comfort level on things that we've always done, and it's really hard to do that. It's really hard to step back from something that we've always done, and in most cases have felt really strongly works. And I read this book once, which I probably told both of you about. It's called Mistakes Were Made But Not By Me. And it's a psychology book about, why people justify their actions, even if they're presented with other options to do things differently. Because it's hard to admit that maybe we've been doing something wrong. And, I think we need to reflect on that. So the last polling question that I want to ask our audience for feedback on is, so I guess this was my question earlier, how do we ensure that it's really a community agenda? And so we and not just people around the table. So we build these, collaborative spaces, we bring partners to the table. How do we make sure that it's really the community's needs being represented? So we get consensus from the community itself. Any other thoughts, Nancy or Heather? Any other thoughts about how do we actually do this?
Well, one of the things that I've used, and it's actually outside of a health context, but in a local government or a municipal context, but I think it applies, is that when you have people participating in the budget process, and I've even done exercises like this with little kids in elementary school to help them understand how, public budgets work and those types of things, where you give someone the authority to award, depending on where you are, $1,000, $10,000, and say, okay, if I gave you $10,000, and actually give it to them because it's their money, if you can get people on side, say, okay, you have $10,000. What is your priority that you're going to spend that on? Because that really empowers them to collectively work together and collaborate and decide what is the number one priority they want to spend that money on. And so it gets people on side quick, or as soon as you put money on the table, there's always some healthy discussions. And it also helps them understand the realities of sometimes, as much as we might like to do things in health, we don't have the funds. And I hate that as a response, but it is a reality with system constraints sometimes. So if you can give people the authority to spend the money, that definitely will help get them to set the priorities of the agenda together.
I think that's bang on, Heather, and I would just add, I think the answer is in something in finding common shared values in community. So that's changing the language and really hearing what people are speaking about in terms of their values. For example, we've been talking about housing as a human right. So when you're hearing people say, well, I want a safe, a healthy community, but getting at the values underneath that, what does that really mean? And coming to some common understanding of that value really sets that foundation to build a true community agenda.
Yep. And making sure, this is coming up in the responses here from our audience, making sure that people from the community themselves are directly involved and directly at that table. So Ashika, I think you can close that one too. If you've got other thoughts, we're going to move into some question and answer now. If our audience has other thoughts, please do put them in the chat box. But we had some questions come through, and I think I'd like to get to those. If you have to leave early, just before I start with the questions, if you have to leave early, there is an evaluation form. The hyperlink is here, but please go in and fill that out. We really do use the feedback to plan future events in these topic areas, so that would be really helpful for you to let us know. So I'm going back to the beginning of the list. So we had a question early on from Claire. Do our speakers have some tips on what to do if the trust has been ruptured? Oh, that's interesting. What's the first step to deal with communities who feel that past engagement maybe hasn't been appropriate or has been offensive?
I think that's important. It's Nancy, and I think it's being honest, honestly owning the fact that the trust has been broken, acknowledging that, and taking the time to hear the other people's stories, hear the impact of that broken trust and what that has meant for the folks, and what that impact really was, to find, how deep that impact has become, and then to authentically begin to come together to re-engage in a more meaningful way.
And I think that, it's interesting with this question, because I'm going through something like this right now with a group that I volunteer with, and there has been a cataclysmic rupture in trust, to the point where we're deciding if we need to stop meeting through that mechanism, take a cooling off period, and then come back to the table to see if we can refocus and agree on common ground issues. And sometimes that's what you have to do. And I know sometimes someone might think that that's a sign of failure or inability to get the result, but that's not the case. People are people, and people are passionate, and it's always a good opportunity to learn maybe what went wrong so that we don't do that again. But I'm a big believer in a cooling off period, and then bringing people together and kind of have a clearing of the air. So if you have to use the talking stick or a feather or whatever, so that the one person has the opportunity and the focus to share their feelings and move on, because people have to get that out, and then to kind of collectively take a breath and then move into some common ground if we can identify common ground. And sometimes we need to break apart in smaller groups and perhaps trying to keep coming back together for the greater good. But it's a process, and unfortunately it causes hard feelings, and when funders are involved, it can really negatively impact nonprofits as well, but it is a reality.
And I've heard, and I've come to appreciate recently that there's importance in privileging some voices that maybe haven't had space or place, haven't been privileged. That those of us, so I'm a white woman, I step back and provide space for voices that haven't had the profile and privilege that I have, and that has been suggested to me as a way to rebuild trust.
I was reflecting on the
work that as decision makers and service providers too.
The work that I did with the homeless youth, the trust was such a key cornerstone to me even being invited in to do the focus group, frankly, because they had such a trusting relationship with that organization, because a lot of the homeless youth that I've worked with and others have really experienced that broken trust from that systemic level. So it's the individual trust, but then it's also pushing back against some really big system trust that's been broken over decades.
Yep. Yeah. And Dave just made a comment in the chat box about trust has been squashed in the colonial system, and then it's reinforced through the current colonial system that we're in. And so, it's the system around us that's reinforcing that, and we're all in it. So we all need to address that. I'm going to move on to the next question. Erin had a question. How do we get people with that lived experience to participate in, be part of committees, join the dialogue to help inform the decision making? And before we answer that, I do want to say that term of lived experience can mean a lot of things. And we're really talking about people who have lived experience of health inequities, so that they're part of a group that experiences health inequities on a regular basis due to social determinants of health that are unequally distributed, right? So how can we make it possible for people to participate?
Well, for me, I think it's reducing some of those barriers that are so problematic. And so it's something as simple as inviting people to the table, but then providing transportation, covering costs of caregiver support, providing food when people come, maybe adjusting the time so that the time to come together is more suiting for folks who have those things. Mm-hmm. And then I think there's real value in inviting people to tell their story and then authentically listening to the story. There's something that's so value connected with that. So not just inviting people to come to sit there, but to come and really tell their story and being open to hearing that.
And it might be that we don't have to be part of a committee, but we find, we being public health as the facilitator, facilitates a different mechanism that more suits the group. I think some really good ideas came in our polling questions, so that's something that we can summarize and send out to people as well. So Mark Andrew had a question. Any advice on how to recruit people to participate in a community health needs assessment? How do we help community members inform the priorities of a needs assessment? And Heather, I think you spoke a bit about this and have some thoughts on this.
Yeah, and I think that this is one of those ideas or situations that goes back to the very first slide where the plan is a nice straight line and then the reality is all of the pitfalls that we run into. I think that's really critical to be there before you need to engage people in the process, because you've got to build those relationships first and then strategically target people from each demographic that you want to ensure gets included or has voice at the table. And I think the big thing is too is that we have to be okay with receiving their feedback in a way that's safe and comfortable for those individuals. So, typically we like to do focus groups and pull everyone together, but for some individuals that is not a safe and comfortable way to get their input or for them to share their stories. So, sometimes it's important to sit down one-on-one. I think of one instance where I had a gentleman that I really wanted him to participate, but he was going through some pretty challenging mental health struggles at the time, but he was okay talking to me one-on-one. So in order to get his feedback, we did that, and we kind of shared it as a story to help inform the context. And I think the big thing is really just to look at the natural leaders in a community as well. I know a lot of times we think of, the head of the seniors group and the mayor of a community and, the head of the Boys and Girls Club, or, the leaders by position, but that's not necessarily the leader in your community. So that's where, if we've had the chance to be there in advance and see who the natural leaders are, and I always say, if there was ever an emergency, who's the one person in town you want to call everyone else because they're going to believe them no problem that they need to evacuate? That's your community leader. That's not necessarily the mayor. So to get in ahead of time and to know those people and understand them, and then as you're talking to someone and you make the approach about participating, I always ask them the question, if you could refer me to one other person who really should be involved, who would that be? And then they're giving me a personal referral as well. So those are kind of some of the tips. And I think one of the comments you mentioned, Diane, is I buy lots of coffee, and luckily I love to bake, and I bake lots of cookies. I'm not above bribery to get people to participate. So, because a lot of people don't cook anymore, so homemade cookies can win.
Yep. Nancy, anything to add?
Yeah, I think that's great. I was just reflecting on the housing survey that we did, and I think along with what Heather's just mentioned, we were really intentional to go where people were at, so not to have people come to us, but actually go out into community where there's natural gathering places. We did provide incentives for our survey, so folks were invited to enter for a draw for a $200 gift card for groceries. We had one community group actually take an iPad out in the street at the community center and just get folks to do the survey online with the iPad. They had some refreshments, that sort of thing as well. And then I think partnering. So we've been really successful. Public Health here has partnered with our community health boards and some of the community health assessment work that we've done. So we don't have to do it alone to recruit people. We can work with some of our natural partners as well.
And if I could just make one more point, is if you ever want to get to parents, children are the best way. And I know in the past I've done consultations at, the high school where I'd buy pizza for lunch, and we'd go in and we'd ask the high school kids and the middle school kids, what do they think it takes to have a healthy community, because they know themselves, they're the experts in their demographic, but they also hear their parents and grandparents or other family members talk. And then with the little ones in elementary school, it's always good just to even talk to them about, what a healthy community maybe looks like, and ask them to draw pictures of, what makes them feel good or what makes them feel bad. And that way, too, they can go home and talk to their parents about the process. And then, parents are more aware, maybe want to be more involved because their children have participated, especially if there are pictures involved.
Mm-hmm. And, and you're right, and all of this, the theme that's coming to me as I listen to both of you talk is that importance of relationships and of having the relationships, and that if for some reason the individual or community members cannot participate directly for some reason, making sure that trusted people that can really represent them authentically can be part of the process. So always finding a way to make sure that their piece is present. So we have another question from Erin, a comment that sometimes community members, there's apathy or poverty, despondency that makes it really hard for people to be engaged. And so how can we reach people who have had experiences that are the most valuable but might be scared or nervous or unable to participate? I guess we've talked about that a little bit.
I think it is. I think it's true. I think it's exhausting to live in poverty. It's stressful to figure where your next meal is coming from, and then, you know, who are we to go ask folks to then participate in something. So again, it's working with, and I've had success with this, with trusted community partners. So when I am hoping to reach out to the homeless youth, I've worked with a youth portal. When I'm hoping to reach out to folks who are experiencing food insecurity, I work with trusted partners at the Family Resource Center, for example. So, you know, they don't know me or trust me, but my goodness, they know and trust Russ at Youth Portal. And if he says it's okay to do this, like it's going to be safe, then that's good enough for these folks. So I think I can't stress that enough, that it doesn't always have to be us, but we need to reach out to our trusted community folks out there who are on the ground doing a lot of this work.
Right. Yep. No, it's very good. It makes me think about actually the next question, which is around power differentials. How do we do something about the power differentials in consultation with community members? And that's a big discussion right now in public health, is power differentials as structural determinants. And, you know, how do we break that down a little bit? Is it relationships again?
Well, I think for me, it always comes back to relationships. And I think really it's, and I know I sound like a broken record, I apologize, but it's investing in those relationships and gaining trust with those individuals. And I find the big thing with the power piece is admitting we all have vulnerabilities, because we're all people, and that you're asking them for help, because we don't know. So it's really helping them see that, you know, you are the expert in this. You have the information that I need. And it's so sad sometimes, or I always say it hurts when people think that, you know, well, what would they have to contribute? They have nothing valuable to say. So part of it is even working on self-esteem and self-worth with individuals before you can even broach some of these topics, because they've been, you know, beaten back by the system so much that it's, you know, they're not ready, and it's not safe for them in some instances psychologically to share. They're not at the right point. But I think it's definitely meeting people where they're at, and you know, I always love it when the executive leadership can come out to participate in community events, and, you know, you always dress in a way that's comfortable and safe for the folks that you're trying to work with, and let them see you in a non-traditional or in a vulnerable situation, and that sometimes can reduce the power imbalance a bit more as well.
And I would just add, you know, sometimes, I mean, there is power in systems, and it's okay to recognize that. And the example I would give is when we were forming our backbone lead team for our youth homelessness project, we were inviting people in and very intentionally said, we want you to step onto this lead team because you have power to make decisions that through informing you, we hope will begin to change some of these policies that are part of the problem. So we needed folks with that power in systems to be at the table to then over time inform them and to be able to use that to begin those conversations at that higher level. So that system thinking, I think we have to acknowledge that power is there, but it's okay if we can use that in a way that's going to help move our policy pieces along.
Yeah, absolutely. I think, actually, Nancy, there was a question from someone wondering if you can you share the link to the youth, the infographic for homeless youth?
Oh,
that
yes.
You showed. Is there a link to find that on the web anywhere?
It's not on the web, but I will try to attach it here, yes.
Okay, no, that's great. And I think the last question we have is that Jocelyn was looking for definition of lived experience, living experience. Is there have you guys got a go-to definition. Mine is evolving. I don't have a go-to, but where do you guys draw from?
For me personally, I keep it very simple. It's someone who has lived through the experience that we're talking about. So most of my work does tend to focus on individuals with childhood trauma or someone in poverty. So when I talk about lived or first voice experience, it's someone who's actually been through that and is safe enough to share. And I know, and I was reading the comments, there were some comments around, you know, what about a caregiver or, you know, someone connected to an individual. And that is definitely valuable as well. I think in absence of a lot of first voices, then that is a very good proxy, but it's always, they're always looking at it through their own lens as well if it's not something they've personally been through. However, they have been through the experience of being a parent to someone who, you know, has lived in poverty or who has suffered substance misuse issues. So that to me, in and of itself, its own lived experience. But I know I was kind of quickly going through some of the research definitions, and they're paragraph and paragraph and paragraph long, and they're all wonderful and valuable. But for me, it's just someone who has been through whatever it is we're trying to work on, because they know better than I do.
And it's interesting, you know, this conversations are coming up a lot for me in community the last couple of months in terms of how do we make inroads. I saw one of the comments coming up in the chat box. This is such hard work. It's hard not to get discouraged. And this whole idea of empathy has been coming up. And so I think, you know, for me, it's empathy that maybe I haven't exactly walked in someone's shoes, but I have some sort of my own personal experience so that I can imagine what that might feel like for them, how stressful that might be, you know, that sort of thing. So I agree that lived experience, you know, has to be there. But I think part of it is connecting to folks to say, you know, maybe you haven't experienced this, but do you remember that time that you were really stressed, and what did you do about that? How did you handle it? So you can start to build a little empathy within our communities to bring a whole, I think, new layer of understanding and compassion to the folks that are the experts in their lives. Yeah.
Yep. Yeah. Well, and that's a nice place to wrap up, Nancy. We are at time, and I do need to wrap things up. Nancy and Heather both, I am so grateful that you participated today and offered us your expertise from the field, because you guys are living and breathing this every single day with your communities, and I appreciate learning from you. And I really want to thank everyone online for their perspectives and their questions and their participation. Please do fill out the evaluation. Feel free to email Ashakor, this email you had in the chat box a few times, or myself directly if you've got any feedback that you, positive or negative. We need to move forward on the issue, and we'd be happy to hear it. So thank you, everyone. Enjoy your day, and let us know if you've got other ideas.